Okay, Jan, you can start.
Yeah, all right. Well, bienvenue tout le monde. Merci d'être présent à cette soutenance de thèse. Welcome everyone. I'm Jan Kestens. I'm going to be presiding this thesis defense. I'm happy to present you Nuttanun Jung, who is a PhD candidate en doctorat en sciences du mouvement humain. And her thesis is about active transportation, health, and environment, a multidisciplinary approach to behavior change, community engagement, and system thinking to promote active transportation. This thesis was also realized in the context of a doctoral Marie Sklodowska-Curie Actions Co-Fund doctoral program, the Boost Your Career, and has also received funding from the European Union's Horizon 2020. So I'm going to present you the members of the jury, and I'm going to start with Kevin Jung, who's a rapporteur and chair de professeur junior and professor at École Normale Supérieure. We also have Steve Whiting, who is an examiner and a technical officer at WHO Europe for the prevention of control of non-communicable diseases. We also have here Sonia Kalmaya, who's a PhD in public health, independent expert working for WHO and former professor at Swiss Distance University of Applied Sciences. Finally, we also have Audrey de Nazel, also an examiner and a full professor at Imperial College London at the Center for Environmental Policy. We also have both directors, Pascal Staccini, professeur de santé publique et directeur de l'URE Rétine à l'Université Côte d'Azur, and directrice Anne Vuillemin, professeur titulaire aussi enseignant-chercheur en STAPS à l'Université Côte d'Azur. Et je finirai par me présenter rapidement. I'm a professor at the School of Public Health, Université de Montréal. I'm sorry not to be present in person, but I'll be with you online from Montreal. It's a little bit earlier for me today, and I'm having my coffee as I will be listening to Jung's defense. Jung, if you want, you have about up to 40 minutes to present your thesis, and after that we'll have a round of questions and exchanges to discuss with you the content of the thesis. So the floor is yours, Jung.
Thank you. I'm just going to move. All right. Well, thank you everyone for being here. And thank you, Jan, for the introduction. So I'm going to be presenting my PhD work that I've been doing for the last 4 years. And as Jan says, it's on the multidisciplinary approach to behavior change, community engagement, and systems thinking to promote active transport. So here's the quick overview of my presentation. First, I'm going to go through the background and the motivation, and then going into my PhD work, and then ending with the discussion and conclusion. So first of all, so for the background and the motivation, I'm going to go through what the problem is, what the health problem we're looking at, the role of active transportation that it plays for this problem, the gap that we're facing, the objectives of the thesis, and the approach that we took within this PhD. So there's the rates of insufficient physical activity are on the rise. We found that the global prevalence of insufficient physical activity has been rising from has been increasingly rising from 23% in 2000 up to in 2022 it rised up to 31.3%, and if the trend continues in this direction, it will go up to 34.7%. And this issue increases the risk of NCDs and reduction in physical and cognitive functions and worsening mental well-being, which poses a significant burden on public health and the health system. So the active transportation plays a role in supporting, avoiding or reducing this issue. Active transportation is a way of getting around while being active. It includes walking and cycling, but also includes other modes like rollerblading, skateboarding, or even wheeling for those in wheelchairs. And active transportation directly increases physical activity, therefore reducing that in the inefficient physical activity that I was mentioning earlier. And because it allows individuals to be active throughout the day while commuting or while going into different places. And this leads to a lower risk of NCDs. But also when people engage in active transportation, they drive less, which leads to a co-benefits of reducing carbon emissions and also reducing noise, which reducing the carbon emission also supports the climate action and the environment. Both of these lead to a co-benefits to reduce air pollution, reduces noise, and also supporting the lowering of the control of the NCDs. However, despite the strong evidence, the co-benefits of how active transportation is a viable solution, the uptake and the support are still low. You can see here in the graph up here, it's an example of a modal split within France and in the Netherlands. We see that cars are still very high, even though in the Netherlands there are more cycling, but cars are still much higher. And for the support, we see that there are a lot of backlash when it comes to interventions that supports active transportation. People are coming out to speak against these measures, which leads to the governments to remove the measures that has already been taken. So the objective of my thesis is to explore the innovative technological solutions to facilitate the active transportation adoption and support, and to develop a comprehensive and actionable insight to contribute to the multidisciplinary approach to changing mobility behaviors. So as you saw earlier with this little diagram, the active transportation impact is on a micro individual levels, but also on the macro and population level. We see that this interconnecting factors of co-benefits and how it interacts as a complex system. So we want to approach the promotion of active transportation with a systems thinking mindset. So on to my PhD work. First, I'm going to start with the individual behavior change approach, and then how we shifted towards the systems thinking. So for the individual behavior change, we're looking to address the people with sedentary behaviors or car drivers and getting them to become an active, to engage in active transportation and become more of an active commuter. However, with the wrong intervention, we could push them from the intended behavior and failing them to get to the other side. So what I want to do is to ground the intervention on behavior change theory and with either the behavior change theory or evidence-based. And we were interested in mobile apps or mHealth because of its high potential as it has worked with other health behaviors previously. So first we did a review on the mHealth that supports active transportation. This work has been published in the BMC Public Health Journal. So studies found that the most potential features are providing feedback on behavioral impact and action planning. And for the behavioral impact, we found that it was most effective when there were multiple outcomes, but also it is very important that these outcomes, these feedback that we're providing are actually relevant to the users. And for action planning, this includes things like route recommendations and travel plans, but in the same manner, it should be personalized. And through in these studies, we found that self-reports testing these features, they found that they're able to increase increase awareness, leading to behavioral intention, which led to the users to try the alternative modes. And the keyword here is try, because when we look at when we monitor the behavior itself, we actually found that there were little to no impact on behavior change. So we found so the limitations of this mobile apps, and also what I found in this study was that there were little maintenance for apps that were created in the academic realm. We found 29 apps that were identified through academic literature, but only 3 were available for the public to download. But not only that, the 3 that were available were all the controlled version. So it wasn't even the version that actually has these app features to help change behaviors. More so, the app engagement and the user retention were not very good. A lot of us will know that when you download an app, you use it for maybe a few days, few weeks maybe, and then you stop using it. Unless it has a social media or something to keep you coming back to it. So this is one of the issues with apps, but also the voluntary usage. If you're not already interested in walking and cycling for commuting, you're not gonna look for apps to help you do that. You're gonna not only that you're not gonna look for it, the algorithms within the app stores are not gonna show up for you to download it since you're not already interested, not searching for it already. And also, lastly, there are external factors that an app cannot provide. The app cannot provide you with a safe infrastructure to bike to work, for example. So even if the apps are not necessarily well-rounded enough to provide to answer these needs. So our next step, we wanted to co-create an app that could increase uptake, because as I said previously, the retention were low and apps weren't interesting enough for people to stay active on it. So we decided to do a co-creation on using concept mapping. So yeah, we did a concept mapping to co-create an app to encourage active transportation. The concept mapping is a systems thinking methodology. The idea of it is to gather ideas from multiple stakeholders to have the concepts of what different stakeholders would need. And in this study, we did it with the participants, with the citizens of Apps Maritime. And it was done online and also in both French and English. So there were biases in this study. The participants' demographics were highly educated. Most of them had either a master's or PhD, and there were high proportions of participants who were already engaging in active transportation or multimodal users, which means that they engage in multiple types of transportation. Maybe they bike and also walk, or bike or take the public transportation. And also, just to show you here, the participants were not required to do all the steps. As you see, we first started with 67 interested people, and it dwindled down into these. So these 3 here are the activities, and it dwindled down into 13 at the end. However, because it is a mixed method study, this number is sufficient for this kind of study. So I'm gonna explain a little bit about how the concept mapping methodology works. As I said, it's a mixed method, and the main objective is to organize ideas from multiple groups of stakeholders. So first step is to brainstorm. We ask participants to qualitatively brainstorm ideas through a prompt that was given. We asked them to sort the ideas into different groups based on the meaning or the theme of the ideas. And then we asked them to rate each ideas on a scale. And for us, we asked them to rate the efficiency of these ideas to promote active transportation for them. So a bit on the results. The first one here is called a point map. We asked participants what mobile app features can encourage you towards active transportation. And each point here are each idea that we're given. And the way the ideas were mapped were based on how the participants sorted them in the second step. So with this map and data, we ran it through a hierarchical cluster analysis, which provided us with 6 clusters. And the titles were provided by participants. And lastly, the rating of the data were averaged for the efficiency of each cluster to promote active transportation. And we had the infrastructure cluster were the highest. And first of all, I wanted to say that we asked for mobile apps and we got infrastructure and the highest efficiency as well. Second were itinerary. These include things like how to basic itinerary, how to get from one place to another with active transportation modes, but also some ideas were about providing multiple types of itinerary or multiple variety types or multiple ways that people can choose from. The third were contact with the governments. This one was a new idea. Basically, people wanted to reach out to the governments to say what they need and what issues they encounter. And then fourth is data. This is similar to what I mentioned earlier with the feedback. So taking data, the mobility data of users and providing them with data to help them navigate active transportation. The fifth one is app usability. This includes things like in-app challenges, gamification, these kind of things. And the last one is legislation and code of conduct, and basically not really related to apps, but basically how ideas on how people should, the code of conducts for drivers and for cyclists and for pedestrians, and how to navigate that as road users or public space users. So this study was published in the Journal of Transportation Research and Interdisciplinary Perspectives. The main results is that in-app challenges are very interesting. In-app challenges and gamification are really interesting for young population. This include things like bike to work or bike to school challenges, and maybe games where people can race each other, etc. For older population, we find that the social aspects like inviting friends to the app were quite interesting. At least they were more interesting than the younger population. They were interesting more for the older population than the younger. And the data on impact was moderate interest from across the groups. So as I said, the interventions have varying efficiency for different populations, but the infrastructure was most important for everyone. And as I said, infrastructure could not be provided through an app, but it remained the most important thing. Itinerary were especially important for those who don't already primarily engage in active transportation. And this makes sense because if people are already engaging in active transportation, they don't really need the itinerary to tell them where to go. And the contact with the government is the novel result that we had, and it had more interest from the younger population where they want to reach out to their local authorities. So from this, we understand that we need to expand the system so we provided a subsystem of what could work in an app-based intervention, but we saw that we need to expand the system and include a multifaceted approach to changing travel behavior. So this image here depicts often when talking about systems thinking. It shows how when we're too focused on what's in front of us rather than the big picture, these people here are blinded and they're touching an elephant. And if they're just looking at what's in front of them, they don't realize that it's actually an elephant. So now imagine what these people would do if they were to interact with what they think is in front of them. They could potentially hurt the elephant, or the person right here who thinks it's a tree could water an elephant leg without it growing into a tree. So systems thinking is a set of synergistic analytic skills used to improve the capability of identifying and understanding systems, predicting their behavior, and devising modification to them in order to produce the desired effects. So basically, when you have an event, you can react to it once the event happens. But when you know the pattern and trends, you can anticipate what's going to happen. When you know the structure and the system, you can design it. And when you reach the mental model that builds the systems itself, you can transform the systems itself. So in my next study, we're interested in the causal loop diagram, which is a systems diagram that's made out of relationships. Each relationship is dynamic, where one factor increases or decreases, it impacts the connected factor. So there are two types of relationships in a causal loop diagram. One is in the same direction, depicted in blue up here. And here I use an example of a green space and tree covers and how it moves in the same direction as route comfort for the route users. And it's basically, if there are more green space, more tree covers, the route is more comfortable. And it goes in the same direction where there are less green space and less tree covers, the route is less comfortable. And the second relationship is opposite, it goes in opposite direction, depicted in red right here. And this example is on air pollution and route comfort again. And basically, because it goes in this opposite direction, when there is more pollution, the route is less comfortable. And when there is less pollution, the route becomes more comfortable. So once you have a full diagram, you can identify feedback loops like this. And there are two types of feedback loops, a reinforcing one, which is the one up here. It basically says that in a loop, when you increase one of the factor, when you move a factor in a direction and goes through the entire loop, it ends up in the same direction as you started. So it reinforces your initial change. And a balancing one, depicted here, which basically means that when a factor changes, it moves in one direction and it goes through the loop, it returns in a different direction. So we developed a causal loop diagram with the aim to communicate the proverbial elephant that is the active transportation system to the government stakeholders, so that they can be on the same page, understand the impact and the benefits of active transportation for their respective departments. So the steps that I did to develop the causal loop diagram, first is through, we used a non-systematic literature search focusing on reviews. And with that, I extracted the relationships that I found through literature and drafting a diagram. After that, I presented it to the experts and researchers to get opinions on the areas that I should add, which then I would do more search to add into the diagram. And then it will go through this for several rounds. And then once it is, we deemed it good, I worked on the visualization and the analysis to prepare for the stakeholders, for the presentation with the stakeholders. So this is the full systems diagram, the cost loop diagram. And each color here represents the themes that correspond to different areas that the government services would be interested in. It includes health, climate change, ecosystem, infrastructure services, urban environments, and economy and society. So during the presentation, I would pull out different loops like this, but also the participants, the government stakeholder participants could also look at specific relationships, and which would show them what that would show them this the specific relationships and the evidence that is behind it. So here's this is the presenting some of the feedback loops. The software found over 4,000 loops, and majority of them were reinforcing. This is the basic structure that we found, basically having these three factors to support the determinants of active transportation, so funding, policy, and space, and how it supports the determinants of active transportation, which would impact the level of active transportation, and then having the direct impact on physical activity, social interaction, car use, and economic benefits. And then it will lead to an indirect impact, which then either supports or supports these three factors. So I want to show a little bit more on the feedback loops. So here is a reinforcing loop. We're looking at how infrastructure impacts active transportation and how it leads to health and how that leads to economy. So this is a reinforcing loop, like I said, where when we add infrastructures, it increases or decreases in the same way, in the same direction. And then it reinforces because it keeps pushing back to the same direction. So it either increases or decreases steadily. This one here is another reinforcing loop that I wanted to focus on. It's on green space and its impact on active transportation, affordable transport, and housing access, and leading to the economy. So in the same way, it's a reinforcing loop. So when we increase green space, we see an increase in active transportation, making transportation more affordable, benefiting the housing access, benefiting the economy, and so on. So it keeps going in the same direction. However, there is unintended consequences of green gentrification. So this is where we see the impact of green space on land value. And this one is a balancing loop, where when we add green space, we actually see an increase in land value, decreasing the housing access, making it worse for the economy, which means less funding for the development or the care of green space. So in reality, we see a relationship that is complex, but because now we better understand the system, we know what to expect, and we can minimize this unintended consequences. So with this, the participants, the common stakeholders who viewed the systems that I created, most of them said that they were understandable. Actually, only 4% of them said that it was difficult, and 9% said it was neutral. But I will say that the presentation is key. I didn't just give the map to them, for a diagram to them to look at it on their own. I actually present to them how it worked and how it can impact their respective departments. So on to the discussion and conclusion. I will go through the main findings of my thesis as a whole, the scientific contributions, and the remaining gaps in the future research. So this is how I depict how my findings fit together. I'm I base this on the theory of planned behavior down here to show the potential of behavior change. And then using the socio-ecological model of health promotion on the side here to show how my work addresses each level. So first, I'm going to start with the behavioral setting. Here, the behavioral setting means that the setting of where the behavior takes place. So here we have mobile apps and the environmental support. So the mobile apps lead, as I mentioned earlier, it can help with the intention and the intention to increase the intention and the motivation of people through the feedback and goals and through the actionable information and action planning. And then we need the environmental support to reach the behavior itself for a supportive and enabling environment. But this also has to mention, it should be mentioned that the environment needs to be, the supportiveness and the enabling needs to be perceived and structural. So if we have, or if a bike lane is created or a pedestrian path is created, but the users themselves don't perceive it as actually useful and helpful for them, then it does not count as a supportive environment. And also the importance of habit discontinuity in changing travel behavior. This includes internal interruption. So things like what a feedback can do, how it can show you that the current mobility behavior may not be contributing to your goals. And this is a type of habit interruption or discontinuity, but also a physical interruption like a removal of a street parking or even a disruption in the fuel supply could motivate people to potentially consider the alternative transportation modes. And then and then the other part is on the proximal leverage point and the distal leverage point. So the proximal leverage point is the levels where it can impact the behavior settings, and the distal one is how it can are the things that can impact either the proximal leverage point or on a multiple level, impacts on a multiple level. So here we see that there's a need for a transition, from a siloed way of working towards systems thinking and collaboration. And here I did it through the use of systems thinking approach and how we can use that to encourage government collaboration and government support and action to support the change in the behavior settings. But also how the citizen engagement and support is very important to get the government support. And through my last study with the governmental stakeholders, we realized that we understood from them that the need to support collaboration is by more funding and resources, citizens participation and support, like I mentioned, and also a tool to facilitate this collaboration. So again, here is how it all fits together. So the scientific contribution, just a reminder, the gap that we were looking at is the uptake and the support of active transportation. And my PhD looks at these three areas of mobile apps, citizen support, and the governmental collaboration. There's a high potential synergistic impact for the mobile apps to promote active transportation through both citizen support with the government, but also and also the behavior change itself. Also as a government and citizen communication platform, a potential one. The government and citizen communications are, we find, complementary needs. The government wants to listen to the citizens to help them make decisions that is best, that will have a good reaction from the citizens. and the citizens themselves want their voices to be heard. However, there is an issue because there isn't a good enough way for this to happen, for them to communicate, basically. Then I provided the evidence-based causal loop diagram of the active transportation ecosystem, and showing how there is a need for a multi-level, supporting the growing realization that there is a need for multi-level and multi-stakeholder intervention. So there is still a remaining gap. One being how do we reach the uninterested citizen? I mentioned this with the apps. We have a potentially, even if we have a potentially good app that can help people change their behavior and whatnot, but if they're uninterested, how do we reach these people? The ideal condition for citizen engagement, like I said, there are citizens who wants to engage, but there is a issue of actually making this, doing the data collection for citizen engagement in a way that is efficient. And also in the habit discontinuity, especially for the external interruption, where we want to do a physical external interruption, how do we do that with little backlash? Or even how do we could we potentially use disruptive events to support the habit discontinuity? So things like I said, with the fuel, the rise in fuel prices. If we could use events like these to support active transportation, to push people to consider changing their habits when there is a discontinuity, or even there were some studies that targeted incoming college students to when their habit is discontinued because they're moving to a different city, if we could use that as a push towards change. And so the potential for future research, especially with the causal loop diagram, we could integrate this causal loop diagram with an economic impact, for example, to create a more dynamic system. Or we could develop this causal diagram into a more comprehensive tool to be tested in a case study to see how it can be used in a decision-making or policy-making situation. And that is my time. Feel free to get up and stretch. I know we've been sitting for a while. So yeah, thank you.
Thank you. Thank you very much. Yeah, a little bit of active transportation around our chairs, maybe. Thank you for also respecting the time. So we'll now go into a round of exchanges, and I will start with Kevin Jean as one of the rapporteurs for this thesis. Kevin, you want to start?
Yeah, thank you very much. So thank you so much, Jung. I'm very glad to be a reviewer of this work because I first met with Jung as an MPH student in an internship in our lab. I was not supervising her, but I'm very glad to see that. Yeah, she did very well through her academic journey, and I'm very glad to be here in the jury today to attend it. So thank you so much for that. Thank you, Jen, for your presentation. Very nice presentation indeed. A very visual one. So this is the same picture that you gave in your written report, very nicely written and very nice illustrations too. This is really a very important asset for a researcher, I would say, and even more for a researcher working at the contact of stakeholders to be able to share your results and your concepts with very nice illustrations. And I've seen that we all witnessed that today. So thank you for that. A few words. So I really appreciated the interdisciplinarity and the originality of this research. I should say that to me, it's perhaps the first time I see the system thinking framework to be implemented or used in the field of public health, and this is kind of a important discovery for me. So thank you very much for this. I've been also really impressed by the diversity of tools, methods, and the fields of each of these tools. So system thinking, network analysis, surveys, and so on and so forth. So that was a very nice demonstration of all the tools that you have been able to identify through different scientific fields and apply to your own subject. So congratulations for this. Just a quick feedback on one specific point of the presentation. So you mentioned 2 times, I remember the ecological backlash in your presentation. Uh, just allowing a few words on that, because I really think that we should be careful using this concept. This is really a risky one to me, because it's a risk of, how do you say that in English, like prophecy autoréalisatrice. The fact that, to me, and this has been also documented, so politicians use this concept to justify some decisions that they wanted to take. So I'm not sure this is so much of a real phenomenon. Yeah, and we have also had some surveys and studies by the ADEME, for example, in France, showing how decision makers, politicians, do overestimate the opposition to for cycling policies, for example. There has been surveys showing that for example, mayors or local governments do really overestimate the opposition to cycling infrastructure in France, or rather to policies to decrease the place of cars. And so using this ecological backlash concept is something that to me is somehow risky, and that does not correspond to the reality. So just a few words on that. So then let me go into a bit more details about the works and into the discussion part. So I did really appreciate in your work in the introduction, the presentation of the models and the theories for behavior change. So thank you for that. I wanted to have a bit of your insights and on your feelings about the, perhaps the one or those to be used for implementing public health strategies. If I compare to another field that I'm working on, nutrition, so how do we change nutrition behaviors? In the nutrition field, the COMBI model is now the model who seems to have gained the highest level of interest in the present years. So I wanted to hear a bit from you about that. You mentioned the COMBI model for physical activity, but that's not the one among those that you discuss in the end of your discussion. To me, it gain interest because it's quite simple, and it's also easy to operationalize. So just wanted to have a few words on that. And also on another question, so based on your own results, which one of these model would you bet on? Which one is the one that your results do support the most between those that you present? For example, if you have say a huge envelope to implement an intervention of your choice, which behavior change model, which behavior change theory would you rely on to design your intervention? So a few questions. Perhaps it's better to have your answer now and then to go to other question then. I don't know what Jan prefers.
We
I
can yeah, you can start responding maybe you and yeah.
So I don't forget. So the first question was about the backlash and the reactions from the governments around this backlash. And I totally agree that the stakeholders sometimes overestimate these backlash. And actually, I can refer to one of the master's students of Audrey who did a study on Twitter, I think it was Twitter, and looking at the support of people on the low traffic neighborhoods. And here we saw that there were actually, if you look at the amount of people who were tweeting positively, there were more people who were tweeting, but then lesser number of tweets that were coming out. But when we look at the negative tweets, there were fewer people or fewer accounts that were tweeting, but a lot more tweets and a lot more louder. So this is the whole phenomenon of the loud minority. And it definitely is true that it provides a wrong impression to the stakeholders in making these decisions, which is why I think it's really important to have a good method of getting citizens' support and citizens' voice, especially the ones that are supportive, because we know that people are supportive of this, but they like it's in the same way as when you go on I'm thinking of like a Google map where you comment on places. You have more comments, you have more bad comments because people are more likely to comment when things are upsetting them rather than when things are good for them. So I totally agree. And I think there needs to be a better system or a better way of communication between the governments and the citizens themselves. Your second point was on the COMBI model, and I think it was on the behavior change aspects. And so yeah, the COMBI model is I think it's a good model to go off of. However, I focused mine on the theory of planned behavior, like I did here down here, because a lot of the studies that I found, they look at how intention changes the behavior itself and how we can impact the things that leads to those intention, and how we can basically move from intervention onto the behavior to change the behavior itself. But I think one thing to really focus on when it comes to travel behavior is that it's not the same. There is a different approach to it, because it is also about when people think of how they want to get from point A to point B, it's also about the convenience, the comfort. There are a lot more factors that come into play when people think of how they want to engage in active transport, or how they want to move from one point to another. So my point would be that I think it's important to look at these behavior change theories as not sure if I want to say as a whole or as a combination with the different aspects. For example, like this this theory of planned behavior does not talk about habit discontinuity, but I think it's a really important part of travel behavior, because when you think of when you get up in the morning, how you want to get to work, it's a habit. You don't consciously be thinking about, oh, I could change my habit this one day. So the discontinuity of it plays an important role, which is why I think there needs to be the approach towards active transportation needs to come in a systemic way, looking at different aspects rather than looking at one theory. Was there one more question?
I think you answered. Oh yes, no, okay, no, I think you answered also. kind of answered the third one about the theoretical framework you would apply on if you were to design an intervention promoting active
Yes.
transportation.
Well, if I were to design an intervention, so with my work on systems thinking, I think that there isn't one perfect intervention, because it needs to be a systems work, because we're trying to change the behavior of a society, of more than just a few people, but as a society, as a landscape, a built environment. Therefore, it needs to have a systems approach. So there are different leverage points that we could look at when it comes to the system, but the best way, in the best method of changing a system would be to influence the mindset that creates the system itself, which is very difficult, but it is the mindset, like I showed in, where was it? Here. I'm sorry, you can't see that one right now, but the systems thinking iceberg, where we have the mental model at the bottom here. And this concept is really really important, because if we want to change the systems, the best way to do it is to change the mental model, to change the mindset. So yeah.
Thank you. I really like your word saying that what we need to change is not the behavior of individual, but the behavior of societies. This I truly agree with that for all, say, climate and environmental policies. And this is something that we see in your own results as well. So your own results do find what others described before, the fact that to change active transportation behaviors, you need to have infrastructure, you need to have the environment. And so that somehow explains some of the results you found in the first studies, like showing that uh, actually a mobile app can't change the environment. You can change perception, motivation of individuals, but not change the environment. So what can we, and somehow you discuss that very well in the discussion, saying that one of the major lever could be this kind of citizen support, which is not the same that changing behavior. So people could support active transportation policies and not change behavior themselves, and which is something important. So here we have something that is kind of a trade-off between studying environmental or healthy behaviors at the individual level based on theory of behavior change, and to reconcile that with the collective level, which is the level of action that we need. And I have a question for you about that we have now plenty of research showing that the argument of health, this is good for your health, is not sufficient to change individual behaviors. However, we may have some elements at the moment showing that if you don't change the behaviors of individual playing with these arguments, this could, however, change motivation, so say political demand, adhesion to public policies, or what you call citizen support. So I would like I would like to hear a few about this hypothesis. So how could we, how could we use these arguments not to change individual behaviors, but rather to play at the collective level or at the citizen support level? And eventually, and you understood the causality chain. If you have a strong support for public policies, you will change infrastructure and the environment, and eventually change individual behaviors, but maybe not for yourself, but at least for people around you as well.
Yeah, thank you for those questions. So I wanted to talk about one of the point that you made about how people could support policies for active transportation without already engaging in active transport. And I think this is a big point to be made, because people can sometimes for people to engage in active transportation, sometimes they might think about, oh, whether I'm fit enough, whether it's safe enough for me. But it doesn't necessarily mean that they have to change already in order to support the policies for that change. And this is where the citizen support comes into play. Like, I feel like there needs to be a case made that you can support these policies without hardly taking a bike to work, because people, especially when you think about how people need these infrastructures, as I said in one of my studies, people need infrastructures first. But if infrastructures aren't there and they're not pushing for infrastructures because they're not doing it, it basically, I'm not pushing for this this positive feedback loop to start. So there needs to be a push first for people to understand that they can support these policies without already engaging in the action, the behavior itself already. There was the health aspect that you mentioned, using health aspects to promote active transportation. And this one's actually quite interesting. I think the health aspect is really important for public health and for citizens, for governmental stakeholders to realize the benefit, because we do find that on an individual level, the health aspects were not considered as much. People may realize that it's beneficial for their health to ride, to walk or ride their bikes, but it doesn't necessarily pushes them to change their behavior. It's more like it's good for my health, but it's not a motivator to make that push. So on an individual level, I guess I can also say that when like going back to how people make decisions on what or how to commute, it's less likely that they're gonna think, oh, I will do this because it's better. I will take a bike because it's better for my health. It's more likely that they're thinking about the time it takes to get to where they need to go, or perhaps the convenience of it. So yeah, just to reiterate, the health aspect I think it's most beneficial or most efficient to be pushed with the governmental stakeholders, and how they can basically reduce if they increase the health of their citizens and population, then it means that there is less need and less burden on the healthcare itself. And that could be an efficient point to make towards or with the stakeholders, which I really tried to push when I was doing the causal loop diagram here. So yeah.
Thank you. And then perhaps the last question. So I really appreciated, as I mentioned, the fact that you were developing this system thinking approach in your method. I did not know the work you mentioned as references about previous efforts to use that for health promotion or health interventions. This is a literature I really enjoy to discover. I knew about the system thinking approach, the seminal work by Donella Meadows, and especially the way she described the leveraging points to change a system. So she mentioned several points, from the easiest to leverage to the hardest, the easiest being those who have the lesser effect. This is something you already kind of mentioned, because some of the points you have been mentioned in the presentation correspond to this leveraging point, for example, feedback loops, and the mindset of the system as well. But I mean, she developed this framework about like 8 or 9 leverage points, for example, delays in the feedback. If you can change the delays in the feedback process. You may change the system. You can change the rules of your systems, which is much harder, but could have much effect. This is also something you can try. I would just like to hear you about, did you think about using these leveraging points by the Nelamidos? Is it relevant? Is it something that is now outdated in the literature? I just wanted to have your inputs on that thing, especially for the active transportation system and the system you described.
Yeah, yeah, that's a great point. It's true that when you're thinking about, when the literature you read about the cost loop diagrams, it's less on the promotion of active transportation or promotion of anything really. It's more looking at the systems of how the current system of things are. But I did want to create this on the promotion of active transportation, because the main idea of my project, or this project, was on getting the governmental stakeholders to be on the same page. So that's the first point. For the leverage points, yes, I did look at the ways that we could impact the system through different leverage point, and the ones that resonate best to me, and especially when it comes to the promoting active transportation, is one, driving the positive feedback loop, meaning with the feedback loop that I presented, where it keeps going in a circle and keeps reinforcing the positive feedbacks. I think there's a lot to be done to make sure that this happens, especially for things like this, to make sure that it keeps going into the same direction. It keeps driving this positive feedback loop, or the reinforcing feedback loop, that, as I mentioned here. Another one would be managing the negative feedback, or managing the balancing loop. And this was the one where I showed you how the impact of green space is good, but it also impacts the land value, which is the phenomenon of the green gentrification. And I think there's a really strong point to be made here when it comes to managing these negative feedback loops, or also I can also mention this as minimizing the unintended consequences. So with a diagram, or with a systems diagram, a systems mindset, we can identify these unintended consequences, and therefore manage it in a way that reduces the potential impact. And of course, like I mentioned earlier, with the influencing the mindset that builds the system. And I also want to mention that with this presentation that I made with the stakeholders, one of the things that I found, one of the positive thing that I found, was that one of the results, sorry, was that I was able, or in the survey, we found that we were able to change some ideas of people and of the participants, and change them towards the support of active transportation. For example, there was one question that I had on, do you support the disincentivization of cars? So basically things, policies like removal of parking spots, like car parking spots, or removal of car lanes. And we did get one elected officials to change it was a perceived question. So they perceived that they did change their perception towards supporting these policies. It wasn't a lot. We didn't have a whole lot of elected officials to start with, but having that one person did change their mind was a an impact that I can be proud of. Let's say that.
Okay, thank you very much.
Thank
Yeah.
you.
Thank you, Kevin. Yeah, that was it for your questions. We're good to go. Okay. Thank you, Jung, for these answers. And now I'm gonna change hats and I'm gonna transform into examinateur again, or rapporteur, sorry. I have a few questions for you. And first, I want to really say that I had a blast reading this thesis. I really enjoyed your work. I found it really well written, the quality of the illustrations also, and the coherence of the work I found really very, very interesting. And also the coherence between your back and forth between the theoretical dimensions and thinking and if I can say, practical use of um, tools and advanced tools and of course the whole system thinking approach, which I like. And I've myself played a little bit with concept mapping, with also causal loop diagrams, and so it was really a pleasure to read this work. So maybe just a few questions here and there across the thesis. One thing that struck me when I read the chapter on the concept mapping that you did to co-create the app was that people didn't really, I mean, sometimes I didn't really answer the question. And when you asked about the features that the app should have to promote active transportation, well, as you mentioned in your presentation today, a lot of people referred to actual environmental dimensions, which were not at all something to do with an app. So can you comment a little bit on that? Because I have the feeling that it's sort of does it invalidate the point that the app itself is useful, or that there are more profound structural dimensions that are core to these behavior changes? So I just wanted to hear you about maybe the limitations in the concept mapping exercise when people don't answer the question, or if they don't answer the right items, what does that tell us, and how can we use that in a concept mapping exercise to pursue the work, and not ignore these answers? Because I've been sometimes through processes where we have concept mapping brainstorm exercises, and then there are these ideas that don't really fit into the question. And sometimes when you do the data reduction from all the brainstorming to the manageable set for sorting, sometimes you remove items that have nothing to do with the question. Of course, in your case, you kept them because they were essential. But can you tell me a little bit about what you thought about that? If you have
Yes,
recommendation.
definitely. Yeah, thank you for that. Yeah, the it was really interesting to see how we specifically during the concept mapping study, we specifically asked for app related ideas, and because there were so much ideas on infrastructure, actually it was the cluster with the most ideas, which at first I was considering when I was first getting the results were coming in. I was like, oh, okay, maybe this is not relevant, so maybe I'll remove it. But it turns out it was a lot and it was significant. So to me, that really said that people were very passionate about what they need, about how infrastructure is a very important part of this need. And so that's the reason why I kept it for first of all. I will say if I could do this again, I really would try to do an in-person. So there's pros and cons with online and in-person activities. The online one, I can definitely say that I was able to reach a lot of people, at least in the beginning. However, with the issue with online studies or online, especially with multi-steps studies, people dropped off because people were either busy or they have other interests. And this is something that is hard to manage when you do a multi-step study online. However, if you there is also a constraint when it comes to in-person one, because maybe people don't have the same schedule. You may reach people who work from 9 to 5, but not the people who are working after 6 p.m. or so on. Those people you might not get, and those might be the people who you want to reach. And so there are benefits and negatives for the online study. However, I do want to mention that I was able to reach one of the targets that I really wanted to reach were people who with motor disabilities. And while we were able to reach one, actually I tried to invite the society, the handicap society, and they were able to, at first 2 people were interested, but then they dwindled off, and then at the last step they were both gone. So sadly I wasn't able to retain all of them. But so yeah, my point was that I think the infrastructure, no, the question I asked, I tried to be clear that I wanted apps, but because infrastructure is very important, I think that's why the everyone reflected strongly and coherently on the need for infrastructures. And I might have missed another point of your question. Can you
No,
remind?
that's good. That's good, I think. And I think the interesting feature is that when people talk about apps features around choosing itineraries, well, there might be some combination here with itineraries that have the best infrastructure. So of course, it can be something that can be weaved into the app itself. Maybe next point would be about the system thinking and the causal loop diagram you've built. Do you one of the I would say one of the issues sometimes with these models or these uh, loop diagrams is to be very careful about the boundaries of the system. Of course, your elephant example was great, and it's pretty easy to see the limits or the boundaries of the elephant. But sometimes the boundaries are not so clear, but somehow you also need to stop and define your boundaries. So can you tell me a little bit if you had some issues with the boundaries in your system and how you did so?
Yes.
Manage it?
So I just wanted to reach back about the itinerary real quick, with uh the concept mapping study with the itinerary results. It was also interesting because we had some results saying that people want to be able to choose their itinerary, which is also related to me, it's related to the build environment, because it means that people want to have a variety of options. Like, for example, if you think about car drivers, you want to get from point A to point B, there are multiple ways you can navigate through the roads. Maybe a more straight one, a more less traffic one, whatever. But when it comes to walking and cycling, these options are limited, especially for cycling. These options are much more limited, and it was pointed out in the concept mapping study that having a variety of itinerary is very important. And okay, so onto the causal diagram with the boundaries. It's a great point because it took me a while to reach this point, because at first I was thinking whether I should include a more individual level, how to impact the more direct behavior change of individuals, and then how far am I gonna go? Like the without having a clear boundaries, the systems map blows up, and at first it really did blow up to the point where it was hard for me to navigate myself. And but when how I end up with this was basically putting in the mindset that the main idea of this cost loop diagram is to communicate to stakeholders, and which this may mean that I might not include every single thing, because if it's too detailed, they might miss the point. So I wanted to make sure that they do the boundaries that I set was basically with the aims of communicating my message of promoting active transportation and how it can benefit them.
I see. Yeah. Okay, that's a good point. Yeah. Another question, maybe I've been myself struggling a little bit sometimes with these causal loop diagrams when we try to consider effect modification. And here I'm thinking specifically about gender aspects. So we know there are gender dimensions related to active transportation that are quite strong. Um, they don't really appear very clearly in your work. And I wonder if you thought about these effect modification aspects and how do you think they should be considered in causal loop diagrams, which I feel are not really good at handling effect modification because, of course, you can't increase or decrease gender. So generally, gender or age are variables that are omitted from the systems thinking perspectives. And have you thought about effect modification in your work, and maybe more specifically about how you could have or it would be possible to integrate gender dimensions?
Yes. Yeah, that's I think that's really important to mention about gender, because there is a whole research aspects on gender and transportation. And I think it's one of the main barriers for women to either engage in active transportation or even use the public transportation due to harassments and so on. And I can even understand this because there are areas that I have biked through and where there's a lot of people, and it isn't always perceived as well. And sometimes it does hinder myself from active transportation. So I think it's really important to address it. But however, I did not, you're right, I did not have it here because, as you mentioned, gender cannot be, you can't even increase the gender within a cost loop diagram. However, I am reminded of a study that I saw. It was a cost loop diagram that was created in a group in a it was a cost loop diagram activity with stakeholders in different cities. And one of them did mention gender. It didn't mention about the gender the gender aspect that they did mention was basically about the seeing more female riding bikes and how that would impact, or even there was one that was on how seeing male politicians on their bikes impacts the social aspects of active transportation, which is so these are the gender examples that I have seen in literature, and I think it's really interesting. So I mean, I think that something like that could be integrated into a map like mine, because I do think that a map like this is a good start either for a continuation of work with stakeholders and how it can be applied on a local level or in a different discipline or etc. I think it's a good basis that you can expand on, and as well turn into something more dynamic as well.
Yeah, thank you. Yeah. No, I think you're making good points. I suppose that if you had maybe a little bit larger sample in your concept map, you could have also stratified your analysis. And then it's a question of when you do this stratification, do you use the same set of ideas for everyone, or do you stratify earlier and then you have different set of ideas by gender, for example, or age groups, which is another question. So, and then the question is, do you have different systems and causal loop diagrams depending on gender, or these type of questions
Yes.
that I think are of interest. Um, I found it quite interesting that the stakeholders and decision makers found the diagram useful. One struggle also that we sometimes have is that these diagrams are perceived as complicated, not complex, but complicated and difficult to integrate. Yeah, I think the way you've highlighted these feedback loops is one way to make it simpler for the decision maker and simplify the message. But maybe I have a question here. You mentioned in your presentation that the system can identify up to 4,000 feedback loops. Of course, you have all these pathways. How do you choose the ones that are the most important or relevant, or how did you do that process of choosing the ones you highlighted?
Yeah. So with the 4,000, more than 4,000 loops that the program identified, it ranged from like two loops with two factors until a loop that is humongous. And so first, when I looked at the loop, I tried to the way I choose the loops that are interesting is I try to see in what areas that the decision makers have a point to be able to impact. Like at what point they can they actually impact? For example, if there were stuff on I think see, I can zoom in. So there are stuff on like how if there's bike sharing services and bike access, and these are the things that governments can support. So these are the things that I'm more interested in pulling out to show. Whereas things that are more, I guess the things that are more social, like community events and social interaction, these are things that can be impacted by stakeholders, but might not. I guess I made an assumption that it wouldn't be something that is as interesting. Oh, so I did focus a lot of around my maps around the SDGs around here. So I did try to point out the specific sustainability goals that could be interesting to them. And I tried to, when I was presenting the loops, the ones that I chose the most in mind would be the ones that impacts their department and their services. And if it doesn't, I am less likely to show them.
Yeah, okay. Yeah, that's interesting. And maybe there could be some type of combination between the concept mapping ratings. Often items are rated in terms of, I don't know, importance and feasibility for change, for example. And maybe this could be added to the system, to the causal loop diagram, so as to have some idea of how people perceive feasibility of intervention, for example, of our policy to change these aspects. Yeah, it's interesting.
Yeah. Yeah, actually,
Um,
just
yeah.
wanted to add, like I think it's a good point because the concept mapping is a systems thinking approach too. So I do think that I actually some of the points that the relationships that I have here are from the concept mapping results as well, especially the one that are stronger. So
Mhm.
it definitely is a possibility of integrating methodologies and using them in cohesion, especially perhaps being able to highlight some that participants or stakeholders in the causal loop in the concept mapping that are more interested in could be highlighted in a map like this. So I think that's a great point.
Thank you. Yeah, and I think the one of the objectives that you had also was to improve collaboration, or try to see what would be the mechanisms for collaborations across government silos, if I can say. And that might require an additional causal loop diagram about collaboration across governments, and then you could have both anyway. Maybe I wanted to challenge you a little bit about the bridge that you built at the end of your presentation. So bridging the gap between so that leads to behavior change and more active transportation. I would say that your first step here, your mobile apps, do you think it's a solid bridge? Or because when I think about the conclusions of your chapter on the mobile apps, it really tells us that, well, you're saying that people might try behavior change or change behavior, but don't really maintain it. Another problem is that these mobile apps are used by people who are already converted. So do you think it really helps to bridge? Just a little bit provocative question for you.
Yeah, I guess if I were to think of it that way, I might make this bridge a little smaller. Maybe not so big, maybe not a third of it. However, a case that I can make for mobile apps is that it is something really close to all of us at all times, and there is a potential for it. But it is true that my results found that it is not necessarily a very impactful in the sense of behavior change. However, I could also make a case for mobile apps that could be created to support decision making. I can also there is an app, one of the app that I reviewed, which is a really interesting one. It's called Giovelo. It's a French app, and it's created in collaboration with ADEME, which is the environmental agency. And their app would they collaborate with local authorities in different areas in France and provide these authorities with a heat map of people who ride their bikes, but people who use their app and ride their bikes. So in this case, I think mobile apps is a great tool to provide these informations to governmental to stakeholders and decision makers. So I think my point is that mobile apps are great to a certain point in different contexts. In a context with governments, it could potentially have it has great potential. In the case of behavior change, it could be really useful for people who are starting to get interested and wanting to know their impacts, and it could help change or help motivate them even more. I know that for me, when I first started out cycling, and when I ran across some of these apps, it was quite interesting, like seeing how often I biked, how good it is for environment, and all these things, that it kept me motivated. I can say that for myself, and also in some of the results that I found through my studies as well. So yeah.
All right, great. Well, thank you very much. I think I'm done with my questions, and I will give the floor to Sonia Kalmayer. Your turn.
Thank you.
I really enjoyed reading the book. Very rich, interesting, and as we innovative and outlooking aspects in it. So thank you for that.
Thank you.
I have two questions. One relates to the third study
Mhm.
on government collaboration.
Oh, you want me to, sorry, you want me to move it closer?
What's going on?
I'm not sure they can hear well. Just maybe we can share the microphone.
Can you hear me, Jan?
Yeah, I think we could hear you well. Yeah, it's okay.
I'll speak up a bit.
Yeah.
So my first question relates to the government stakeholder survey that you did. And it's one aspect of it, and you mentioned it in your limitations, is that you had a bit of a skewed sample towards many people from the health sector.
Yeah.
Through the way that you addressed your sample. Can you discuss how different you think and in which way your results would have been had you had a more transport planning heavy sample,
Yeah.
which is quite important, I think, in particular relating to the express support for active travel versus limiting motorized transport.
Yeah.
And on the level of collaboration and support for these solutions. It's something I would ask of a reviewer if you submitted this as a paper.
Yeah. So first of all, with the stakeholder survey, we recruited through the help of WHO, and they were, so basically the WHO, especially the NCD office, were the one who helped us disseminate the survey. So we had a bias participants, especially with those who are related to the health services, because they are connected to the health organizations. Of course, most of them either collaborated with with other health services, or they are the health services themselves. So it is very skewed, first of all. I do think so in my opinion, if the survey were disseminated more widely, it would make a difference. And a part of what we found, let me just see if I can. So this was a social network analysis that I've done. A social network analysis that I've done from the survey. And we do see a big bias towards the health services, like as I mentioned. But what's we also found, which I would say it's not it's not so strong of a result because there isn't as many, is especially for the national level, for the transport services are really far. And they're not as connected as the rest of the services. You do see that in mutual level as well, but not nearly as much, because we did get a more cohesive system, a stakeholder system within the municipal level. So to answer your question, if I could continue this work, I would probably try to reach more people to get a more cohesive, more realistic situation. But also, one thing I should mention is I surveyed the European government, which means that it's not reflective of each country or each city or it's a very general view. So it would be more interesting, I would say, to do it on a national or local level to see how they actually, like, the reality of the collaboration.
Right. One way you could address it is to do a stratified analysis.
Yeah.
For example, lump together your 15 respondents from planning, transport, and climate change and see how the responses differ.
Right.
With regards to some of the questions. My second question, Jan, is you stole it from me, or I stole it from you, was also about the difference that we see on the prevalence of women and girls cycling.
Mhm.
These compared to boys and men. So you already answered much of it. But I really think this deserves quite good attention, because I'm certain that the mental models are different, the barriers
Yes.
are different, and a lot of the underlying root causes have to be addressed in different ways if we want to get women and girls cycle more, particularly cycle. A lot of them walk more, but in the cycling there is really a big gap, which I think has to be addressed. But maybe keeping that in mind, my second question relates to one of the most important aspects that you already mentioned as one of the future research areas, is how to address those who are not already converted and make them even more active and leave the others even more behind.
Mhm.
And if you can, nevertheless, from all the work that you have done, tell us a little bit about what you think could be promising approaches in making that happen.
Yeah. Yeah, thank you for mentioning the women and girls in cycling again, because I agree, I totally agree. It is a big gap, both in the actions but also in the interests, and as well as this when it comes to safety aspects. I think it's a huge issue. But to add on to that, it's not. I would say that this would also include public transportation, because that not only do a lot of women don't feel safe cycling, but also going on public transportation, which limits the gap even more when it comes to being more sustainable or being more active in their daily lives. For the gap between uninterested individuals, I think for me, the way I see it is, when we already mentioned about the environmental aspects and built environment aspects, and how if environment is good enough, if people perceive it as it's there, or if it's safe and comfortable to use, then people are more likely to use them. And I think the key there is perceive, and a lot of work can be done here on a community and social level. I would say, if these infrastructures are promoted in a way that says, it's great for girls and children and women to use as well, then there are more, it's more likely to reach them themselves. Because even on the bike lanes we see on the promenade, sometimes people are riding really fast. You don't see children on it. Well, you do, but not so much because of that. Well, I think it's because of that. And sometimes when I'm riding by myself, I just want to stroll. I just want to ride slowly, but people are going by really quickly, and sometimes they get upset if you're in their way, all of that. So I think this social aspect is really important when it comes to including everyone and not leaving girls, women, and children behind it, but also including older people who might not be as in a hurry to get to work and want to ride slowly to get to places. I think that's also important. And I think the important part for me would be the promoting on a community level and a social level, but also having infrastructures that supports these people. So example I like to talk about is on a pedestrian path, especially for older people, it really helps to have benches. And a lot of times there aren't benches, or sometimes maybe they're in the park or whatnot, but not always available. Although on the promenade des Anglais there is a lot of benches, so that's great, but that's not the case for everywhere.
Thank you very much.
Thank you.
Thank you.
Mike?
So, yeah.
Yeah,
All right.
should I-
So
All right. Thank you. I'll go ahead.
Thank you. Well, first of all, Jung, it's been unlike the other members of the jury here. I've actually had the honor and the pleasure to work with you throughout your PhD, and it has been a real pleasure. And it's been not only because you've been so determined and hardworking, but also creative and flexible and adaptive when you saw that actually you got in the beginning of your research and started redirecting yourself, getting in. Adjusting to your results and thinking, okay, actually, this is the direction I should be taking now. And that's been quite impressive and it's been a real pleasure. So thank you.
Thank you.
So I just wanted to focus a few questions more on chapters 4 and 5, although of course it all comes together. But I want to go back, and it's been mentioned by you and by others, but on the biases. And first on the causal loop diagram, you haven't mentioned much about who were the experts you worked with and what might be the impact of these experts. And of course, as Jan mentioned, the boundaries are so important, the scope is so important, but the experts that you interacted with will have had an impact on what those the boundaries and what you chose. So if you could say a bit about the types of biases you got from the experts that you worked with, and then also one of the aspects you explain in your limitations is that you engage with experts but not with stakeholders. But is that really a limitation, or could you change the framing of this and say, actually, you've developed an expert-based, kind of more a generic, for illustrative purposes, causal loop diagram, which can then be adjusted by local stakeholders, with local stakeholders, to further engage later. So it's not, so instead of it being a limitation, it's actually the strength that you have something that's not based on local stakeholders, it's something that's based on the literature and on academic or experts in the field, and that can then be adjusted. So comments on that, and then the impact of the specific experts that you engage with.
Okay. Yeah. Thank you for that. And just want to say it's been a pleasure for me as well to getting to work with you so closely. For the expert part of the causal loop diagram, I had a thought in my mind and it slipped me.
So who were they? Tell us who your experts were, and then
Right.
and then you can comment on it.
So the experts that I worked with in setting up these boundaries and modifying what should be on the map and what shouldn't be are so my supervisors, but also the my collaborators at the WHO, mainly in the health enhancing physical activity group and or the NCD prevention groups. Right,
which I would say, similar to your social network analysis, has a strong health focus.
Yes.
Yeah. Hence a potential health bias. So
exactly.
Go ahead.
Oh, so what I wanted to mention that the reason why I mentioned it as a limitation also is because I mean I totally agree with that. Basically, what I created is a health expert focus causal loop diagram, but what I could really I think what I could really benefit from would be some sort of guidance from local authority to say what it is that they actually are interested in, because that was my main issue when I was, or my main not issue, but the difficult part that I had when it comes to creating this was I kept creating and I kept making it bigger, kept making it more dense, and when I was trying to make it less dense, it was really quite difficult because it was hard for me to really pinpoint what could be interesting for them. So, but I think I totally agree that this is a good base diagram where local authorities and governments could use to modify for their own local system, because it may not be all this part of the diagram, not all of it would be interesting for every level of the governments. For example, especially when it comes to the planetary health aspects, this might not be as interesting. It could be interesting, but not for every small local authorities.
Mm.
So
So similarly for your social network analysis and your survey, you have this health bias, and you mentioned it, Sonia just mentioned it, but I want to dig a bit deeper into it because I wonder if there isn't, you do, for example, say that your betweenness measure is not affected by this, but of course it is, because if you mostly survey people who have a health focus, the health is going to be central, but it's going to be in between also,
Right.
and climate is not going to be as in between because
Yeah.
your interaction with the people that you interview is going to be health people. So would you benefit from actually framing, same for the causal loop diagram, and same for this the social network analysis, framing it as a health focused approach, rather than saying, no, well, the limitations
Mm.
are, but actually this is my scope, this is my boundary, these are the people that I'm interacting with,
yeah.
and this is how I start, this is my starting point. I mean, with that, can you comment a bit on how you might frame this a bit differently so that it's as that's your starting point rather than limitation?
Yeah, no, that's it's a great point. I think you're absolutely right, because we definitely did focus the stakeholders, and everyone who got involved were health focused, were from the health perspective, with a health perspective. So I think it can when I try to publish this, I could definitely I would definitely change the framing to a health focused system, of health focused participants, and potentially for health related stakeholders as well. But I do think that it is a good start to branch out to different, potentially to I guess to promote the health aspects to other departments and services as well.
Definitely. And I know you're tired, and I have the honor and pleasure to be able to continue working with you. So I'm not going to take much more of your time. I have one more question, if you don't mind. You mentioned uninterested citizens as being a gap, but is that not the whole point of those the systems thinking approach? Is to find a hook
Yeah.
for people who are interested. So can you, I mean, of course you have the health, the experts on one hand and the citizens on the one hand, and they're not necessarily the same people. But could you use those causal loop diagrams, not just for the experts, but also for the citizens, to find ways of engaging and creating those hooks for all kinds of people?
Mm.
So that's the way that you engage people with within their apps as well, the app as well. It's not with their personal health, that's not where they're interested in, or active travel if that's not interested in,
Yeah.
but all these other aspects.
Yeah, I think this causal diagram, the systems approach, can definitely be used in a promotion with citizens as well, on an individual level as well. I do think that a map like this might not work. We would have to create a tool based on a systems diagram that could be used to promote active transportation. So yeah, I think it could definitely be modified to be an individual approach, and I think it should. I think it can show the potential aspects of what could work for individuals, maybe for practitioners to know how to engage citizens and individuals, or perhaps in a tool that can include things that would be interesting, a tool that could be a good intervention, or include multiple intervention to help behavior change. Thank you.
Great, thank you, Audrey. Giving the microphone to Steve.
Yeah,
Thank you.
congratulations, Jung. Great presentation, and it was really great to see your journey working with you in the early career development program, and now see the final results. So yeah, well done.
Thank you.
I just, yeah, some of the methodological questions have already been asked that I was thinking of, but so I might have a bit more. I have an academic hat on now, that I also work for WHO, so I'm more thinking about policy implications and newer areas of research. But one, not about the methods, but just in general on AI. So since you conducted the scoping review on the M-Health interventions, do you have any insights or ideas on the role of using AI in promoting active transport through M-Health?
Yeah, it's interesting point, because I have really mixed impression on AIs, because I do find that they have a lot of potentials. However, it is very resource intensive, and that goes, it makes me unsure about how it should be used and how much it should be used. Because I do think that it is, I don't work directly with AI, so I couldn't say from a research point of view, but I do, I guess, keep up to date with the research methodologies and the research world, and how increasingly we're using AIs. So I do think that there is, let's get on with the potentials first. I do think there is a potential in integrating AIs, especially on a systems level, when it comes to active transportation promotion. I want to say that potentially maybe we could use it to help with maybe generating some sort of citizen's voice. I'm not sure how much that would be interesting for government stakeholders. But I do, if we could integrate an AI into a system to maybe fill in the gaps that we may not have, or maybe using the information from cities and from areas that are working towards the right direction, and seeing how AIs could integrate those kinds of ideas into a different cities. Maybe to be honest, it's really far from my work, but
it's a bit outside of it's just curious. You've developed some ideas around that. But so active transports, from WHO perspective, we're promoting physical activity, active transport in very different countries, the Netherlands to Denmark. So from your research, would you have any suggestions for stakeholders in countries like Malta or Portugal with very low levels of active transport at the moment, to where to start, and how to share experiences, or what to share from countries like Netherlands and Denmark, very different cultural and geographical differences?
Yeah, I guess my first impression between the Netherlands and Portugal is, I guess the landscape is very different. So that would be a big impact when it comes to active transportation in those areas. But I think like, let's say if we were to create a causal loop diagram like this one for the local situation within the Netherlands or Denmark, and wanting to translate that to areas or countries with less active transportation like Portugal, I think we have to look at, for stakeholders, I think the important things would be the benefits that they could receive through the potential benefits, but also the practicality of it. because the different landscape and the difference in society means that the reaction could be different, would be different from citizens. I could also mention about something that I know locally in Thailand, actually. I know that the Dutch cycling agency have been brought to Thailand to help look at how we can make Bangkok more cyclable. But I think that there's obviously areas to improve in Bangkok, but it's in the same way, there needs to be more of a, I would say, a local ground up approach, or maybe at least a ground up approach and then an advisory from the top. But the movements, I think, is best accepted from the bottom up. So which goes back to the point that I mentioned a while ago, when that individuals could support, they should support active transportation even if they don't already engage in it. And I think that's a big push that should be done in order to create areas that are not already well developed for walking and cycling, to push their local authorities to create what the people themselves need, rather than just having someone on top doing all the changes while it may not be well perceived. And then, as you saw in my earlier slides, the interventions on the built environments just eventually gets pulled out last minute because it is not feasible for the local, maybe it's not feasible for the local government or local community. But also I can just quickly mention, like, similar thing happened in Bangkok a few months ago, where they took out a car lane to make a bike/walking lane in the middle of Bangkok. It lasted 2 days because people were so upset, and the government was not, the point was the government was not prepared that there would be backlash. And I think that's also a very important thing to mention, that there needs to be a communication with the local population that things are going to be happening, or maybe even like a consultation, how we should do this. Things really need to happen from the bottoms up, or else it is likely to have backlash.
That's good talking about that. Yeah, that's it.
Thank you.
Yes, thank you very much. All right, now I'll give the microphone to Pascal Statini, Director.
Thank you, Jan. Just a few words, because everything has been said about your work. Just to congratulate you to achieve this huge work. You began at the COVID period.
Yeah.
And during 1 year, we were lost. And I have to reinforce, to emphasize that point, because you've done the work. Some part was conceptual, and the other part, I agree with you, we lack, people to be involved in the survey, to have a lot of various sample of people, and of course, perhaps the ones that, the people who want to speak about prevention are from the health sector, and not only from the stakeholders sector. I mean that perhaps it is a bias in this study, but I think we have to be more involved into policies as professionals. And I can see it in our city, in the way, for example, my hospital want to elaborate strategies for citizens, for example, because we are in the health system, and people who work in the health systems care people.
Mhm.
And we lack people in public health in France to create what have been asked to you regarding the promotion of health.
Mhm.
So I think it's not the bias of your work, but the bias of our society.
Mhm.
It's my point of view, especially in France. I'm not speaking about other countries because I don't know. And well, your question, Stephen, what about the culture of sport and activity? And you're right when you're speaking about South countries, but I think one key word could be the family.
Mm.
Prevention actions within the family with children. And I think we lack also studies
Mm.
in this kind of area. Not only citizen, because we are citizen at 18, and before we are at school,
Mhm.
and a lot of public health messages lack. We lack messages before baccalaureate. And I think it could be one of our actions. We try to implement this in the second or third year of medical studies to make students to go to schools and to have lectures pupils.
Mhm.
But it's really difficult. Okay, it's called the sanitary service
Mm.
and not military service. But you understand that the way we try to involve young health professionals in this part of their future activity. So thank you again for your resilience.
Thank you.
You are very resilient, and congrats.
Thank you. But just one point I wanted to pinpoint that you said about the family. I think it's a great point of intervention as well. When a family supports active transportation, their children, the rest of the family are more likely to support it.
It's
And
unique.
I think it's a great it's a good, I guess, a setting that a good setting to intervene at as well. Thank you.
Thank you. So to you, Anne.
Yeah, thank you. So here we are, Jung. The significant moment. You can say the culmination of years of research, investment, reflection, and steady and determined work. It was a long journey.
Yeah.
With a moment of doubt, I think, more or less. But you did it. You are there today and you presented. So, and first, before saying a few words about who is Jung, I just would like to thank the member of the jury to be there or online. I think it's a nice jury to judge your work. So thank you very much. And thank you, Audrey, for your investment in the work during the journey. So just a few words on you. As you said, you were born and raised in Bangkok in Thailand. And but you lived in the US for 6 years, where you completed your bachelor's degree there in human biology and psychology. So you have a very different vision of the discipline. And she also worked as a student assistant athletic trainer and got certified as an emergency medical technician. So it's a multi-hat also for Jung. She completed a double master's international public health, international master on public health at first University of Sheffield, UK. and in Paris at the École des Hautes Études en Santé Publique. So, and then I think your work was based in a hospital in Egypt, right? So,
Yeah, the master's thesis was on the hepatitis and transmission.
yeah, very, very international topic. And pre starting your PhD, you has been working as an NGO in Bangkok as a monitoring and evaluation officer. So you had a working experience, and then you started your PhD position at our research unit, the LAMES, here in January 2021. So in partnership, in particular with Imperial College London, with Audrey, who welcomed you a few months in there. From the very beginning of your doctoral journey, you approach your research with a remarkable mix of curiosity, clarity, and commitment. Even if the research topic has significantly evolved over time. I remember the first discussion we had, and I think the topic really evolved a lot until now. And I'm really satisfied of the orientation you take, because we would like to be more specialist on system thinking. And this is the first work really that has been published through this PhD, and it's really impressive. And you have demonstrated valuable qualities. You are discreet in your presence. You are efficient in your work, attentive, and you approach challenges with persistence. Pascal talked about resilience, yes. And you carry yourself with calm, so, or apparently.
I try.
So you have shown that active transportation is not only about walking and cycling, but about transforming how we think and to see beyond individual parts, to understand the interconnections and to design change with intention. So for that, I really appreciate it and congratulate you. And I would like to mention also that during her PhD, Jung applied for the WHO Europe and EPA Europe Network Early Career Development Program, and she has been selected. So it was a good recognition also of the work. But beyond your academic excellence, Jung, I would also like to highlight your human qualities. Working with you has been a true pleasure and an honor, as Audrey said. You are attentive, kind, persistent, and even in the most stressful times, like the few last week, you managed to keep your calm. And I really appreciated the combination of intellectual rigor with humility, patience, and quiet confidence. So really thank you, Jung, for this journey. It was really also, for me, fruitful and interesting. I've learned a lot with you. So congratulations.
Thank you. Thank you so much.
All right, thank you, Anne, for these kind words. So I think this part is now over, unless anyone else has additional questions or comments. Yeah.
So
It's okay?
yes.
There are problems that need our attention. Our population are sedentary with no motivation, unemployment hurting the economy worsened by inflation. Our citizens are aging, faced with isolation. Our cities plagued with light, noise, and air pollution. People are stressed for their well-being, climate change, and global situation. We don't need to reinvent the wheel to help our population. All we need is a seed of vision and water it with collaboration.
The health of our young people is at a crossroad. The latest WHO data reveals an alarming disparities in physical activity, across the European region. Less than a quarter of boys and girls are reaching the recommended amount, and this number falls sharply, especially for girls as they age. Adolescents from less affluent families are less likely to engage in regular physical activity and are more likely to be overweight. Implementing active transportation policies by creating safe and accessible space, such as walking and cycling routes and supportive infrastructures, can make a significant difference. Active transportation not only helps young people reach their daily physical activity goals, but also provides an affordable and accessible means of transportation. Creating school programs that encourage physical activity and expanding green space for active play can be crucial. Meanwhile, green space provides a safe and comfortable environment where young people can engage in sports and active play. Investing in supportive infrastructures and programs like these not only address the physical inactivity and health, but also bridge the gap of socioeconomic disparities.
There are problems that need our attention. Our population are sedentary with no motivation. Unemployment hurting the economy worsened by inflation. Our citizens are aging, faced with isolation. Our cities plagued with light, noise, and air pollution. People are stressed for their well-being, climate change, and global situation. We don't need to reinvent the wheel to help our population. All we need is a seed of vision and water it with collaboration.
The health of our young people is at a crossroad. The latest WHO data reveals an alarming disparities in physical activity across the European region. Less than a quarter of boys and girls are reaching the recommended amount, and this number falls sharply, especially for girls as they age. Adolescents from less affluent families are less likely to engage in regular physical activity and are more likely to be overweight. Implementing active transportation policies by creating safe and accessible space, such as walking and cycling routes and supportive infrastructures, can make a significant difference. Active transportation not only helps young people reach their daily physical activity goals, but also provides an affordable and accessible means of transportation. Creating school programs that encourage physical activity and expanding green space for active play can be crucial. Meanwhile, green space provides a safe and comfortable environment where young people can engage in sports and active play. Investing in supportive infrastructures and programs like these not only address the physical inactivity and health, but also bridge the gap of socioeconomic disparities.
has been deliberating and is very glad to tell you that your thesis is accepted and that you are now an official PhD. Congratulations. Yeah. So maybe I can add a few words. The jury was unanimous about the excellent work you've done, both the written thesis and the defense that you did this morning, or this afternoon for you, sorry. That was really very, very nice. The jury appreciated the interdisciplinary or transdisciplinary nature of your work and considers that your thesis is a strong contribution to the field. We know that systems thinking and complexity science is only at the beginning, if I can say, in the realm of public health. And you really pushed the field forward. So that's congratulations on that. And we particularly appreciated your integration of your work and your results with different theoretical models. That was another strength that was really appreciated. It was noted that you were throughout your work very resourceful and gave also orientation to that work based on your thinking and your ideas and your own contributions. It was also noted that this work and the link between more the academic theoretical frameworks and methods and their applications to policy and to practice is also another tour de force of your thesis, and it's certainly appreciated from the practice field also. So I'm glad to have been able to preside this jury, and I want to congratulate you again on your excellent work, and all the best for the next steps in your career. Thank you. Maybe I can give the microphone to Anne or for last words, maybe, or Pascal.
No, just to ask Jung to read the Serment des Docteurs.
Oh, yeah.
Because
Sorry.
now he will be, so.
She is.
Not
She will read the sermon.
Alright. Okay.
Right hand, please. Yeah.
Yeah, in front of the
Uh,
president.
Okay. In the presence of my peers, with the completion of my doctorate in public health and science, human movement science, in my quest for knowledge, I have carried out demanding research, demonstrated intellectual rigor, ethical reflection, and respect for the principle of research integrity. As I pursue my professional career, whatever my chosen field, I pledge to the greatest of my ability to continue to maintain integrity in my relationship to knowledge, in my methods, and in my results.
Thank you, and congratulations again.
Congratulations. So if we can have a photo with a member of the jury and Jung now, if you can stay connected, because
Yeah.
and then maybe
Yes.
Jung after the photo will have a few words to tell us.
Yes.
How should we do? We go there?
No.
Or here, I don't think in front of the thing, if that's possible.
We take the photo, Clément?
One
It's better
second.
to stay here with the.
You can stay here and if you can have the president.
1 second.
Just.
Now that I'm done, I forgot how everything works.
What?
No, not like that. Does that work? Share.
Ah.
Well, how do I get them back? Participants?
Where are they?
Because I need to get back to the.
It's just a
No, I need to.
technical
oh yeah, okay. I need to
adjustment.
get them out of this one and go to This one.
Mhm.
Where? It crashed.
Oh, the PowerPoint?
Yeah, it
No,
crashed.
it's okay.
It's okay, Jung.
Now we can crash, no problem.
Like to.
What does it do that?
Just have them on
I
the
think
back.
you should.
No, because I want this on the back. Go ahead. Now what?
To go full screen with this. Just go full screen.
Yeah, and then
And then we have them as an
Maybe not
icon.
full screen for this one. Yeah,
okay, or maybe the view.
like that.
Yeah. Like this?
So that
Is
we
it
can
okay?
see the title.
Like that?
Yeah. Yeah. Good.
Wait,
You
wait,
need to hide your camera and my camera?
Yeah.
Okay. 1 second. Okay. And in the parameters, I was hiding my
It's fine,
camera.
it's fine.
Like
I'll
that?
just do this.
It's almost
Yeah.
okay.
Yeah.
Perfect. Okay.
You have to go to the middle.
Over there.
So men and women, so stratify.
Le chat peut être sur la photo aussi, hein.
Ouais, il est très social, ce chat. Ce chat est très social. Il est toujours dans les meilleurs moments. Bon.
It's okay?
Thank you.
If you have two more.
Yeah, just a few
Take the mic.
words.
We don't see you anymore, but maybe it's okay. I don't know.
No, wait,
I
wait.
think it's for the picture.
Wait,
I
don't know.
yeah, we see you. Yeah.
Good. It was just for
There
the
you go.
photo.
Okay.
Okay. I just want to say thank you for everyone who's here. Thank you so much for my jury member, my supervisors. It's been a long journey, and there were definitely moments of doubts whether I was going to finish or whether when my paper was going to get finally published. That was probably the worst part of the whole journey. But the rest were great. I had such great support. Whenever I needed help, I had them. Whenever I struggled, I know who to go to. Whether academically and whether at home, my partner helps me with everything, especially this morning when I snapped at every little thing. It was there. We stay calm and they didn't get upset when I snapped. But yeah, this thesis has brought so much for me. Whether it's the knowledge I learned, but also brought me this new passion that I have for active transportation, for health, for public health. And it's been a great journey, and I'm very excited to move forward and to go on to my next steps and hopefully make a lasting impact to health, but also for individual health, but also planetary. Thank you. Thank you very much.
Merci Yann, merci Kevin. Il y a un petit something over there
Yes.
for people. So
There's food outside that I prepared, Thai food mostly. So enjoy. There are some spicy food, so be careful. So Jan and Kevin, you're not here. I'm sorry.
We are sorry.
We'll find another way, another day. Don't worry.
Sounds good.
merci Yann et Kevin, merci beaucoup d'avoir été présents. Et Yann, je te recontacte pour le rapport et le reste des papiers pour voir comment.
Ça
D'accord.
marche. Très bien. Merci beaucoup à vous.
Merci à vous pour
Merci
l'invitation.
beaucoup. Hein. À
Bravo,
bientôt.
Jen.
Au
Thank
revoir.
À
you.
bientôt.
Bravo, Jung, encore.
Bye.
Bye.
Well, I'll see. That's